Praise the Lord. Praise the Lord. And welcome to Thursday night Blueprint for Wellness. Blueprint for Wellness. We're going to wait and see all of the lovely names that start popping up on the screen for our health educational talk. We are so excited to be here on Thursday to bring pertinent information to you regarding your health. So it's always a pleasure to be here with you on this platform. We're just waiting. We need all of our regulars to drop your name in the chat. Let us know that you're here with us on today. And again, we are so very, oh, hi, Davis. Praise the Lord. We got Gina Kendricks. We got Sharon Timmons. Thank you. We want you to share. We are so thankful for this grant from Choose Healthy Life. It's really been a game changer for all of us that have participated in the program, where you can go and you can get your Blueprint for Wellness. It's a screening done, and it costs you absolutely nothing. So if we didn't learn anything else through the pandemic, we learned that our health matters. Put it in the chat. Those of you that are with me, praise the Lord. We got Jamie Johnson. We got Shelby Crawford. All of us are excited to learn more about our health and how we can make ourselves a priority. Not only make ourselves a priority, but be our own best advocates, right? So no longer do we go to the doctor's office and we just sit there and let them tell us what's going on with our health, but we're going to write our questions down. We're going to do some searching. We are going to ask pertinent questions regarding our health. And then when we're done, we are going to feel empowered. Again, we want to say thank you to Rhonda Douglas. Thank you, Judy Joseph. Thank you to Leslie Cooper. Thank you to my friend Alvin Slaughter. This type of session, we want to get this information to our loved ones, to our friends and our neighbors. And so we're thankful that this is a recording that we'll be able to go back and share through the different avenues, our Facebook, on Instagram, and we can come back to greatergracetemple.org to reference this material, because this material is power. Somebody put it in the chat. It's power. Hello, Verbena. That's First Lady Zimmerberry, y'all, in South Carolina. Thank you for joining us, Verbena. Always good to see your face. And hello, Tracy Harris. We're so thankful for all of you that took the time to show up on tonight. And we want to say welcome to Judy Joseph. Welcome. What we want you to share, Sister Celeste is a phenomenal doctor. She is so humble. You wouldn't even know that she is a doctor, but I'm going to read her bio. We got like 25 people on the line, and we do want you to continue to share from your social media platforms so others may be able to join. We are streaming to 4 platforms, so we know that there are more of you out there under the sound of my voice, and we want to thank you. And I'm going to introduce our friend as well as our doctor that will be presenting on today. It is Dr. Celeste Williams. Dr. Celeste Williams, she is an advanced heart failure cardiologist. She has been appointed at Michigan State and Wayne State University School of Medicine as an associate professor of medicine. Dr. Williams is a medical director of the Cardiac Transplant Program, an associate medical director of quality for the Heart and Vascular Service Line at Henry Ford Health. Dr. Williams has been active in clinical research, education, lecturing nationally and regionally, and organized community outreach and quality projects geared towards improving access to healthcare and equality. She's also a member of Greater Grace Temple. So without further ado, we are going to bring her on the screen. And I thank you, Verbena, for your beautiful words that you're sending. Welcome, Carol Hale. And here's Dr. Williams.
Oh, thank you so much, Sister Dana, for this. Just such a nice introduction. I appreciate it. And thank you for the opportunity to have me speak on this so important issue. And when you asked me to speak, I was like, wow, this could be a really great topic. And I think there's going to be a lot of sharing that goes along tonight. So I will share my slides. So I don't want you guys spending a lot of time writing down everything. So we'll share the slides. I want you to kind of think about the questions you want to ask and put them in the chat. And Sister Dana will take care of that at the end of the session. We'll have time to answer your questions. So without further ado, I guess I'll get started, huh?
Okay, so I'm going to drop from the screen, put the presentation up. I will be able to hear you. So when you're ready for me to advance the slide, just say next slide or next, and I'll take care of you.
Okay, thank you. Okay, so being your own advocate in healthcare. We're going to talk about really what that means and how you can be an active participant in taking care of yourself. Next slide, please. So we'll first start kind of tell you what the current state is. So Google did a big survey, a consumer survey, and they surveyed about 1,500 people. And out of the 1,500, 27%, so around 450 people, said that, they really don't like seeking medical treatment because the system is so complex. The healthcare system is really complex. And a third of these respondents were, when we asked them some basic question, or when Google asked them basic questions, they didn't even know the difference between like copay, deductible, just some basic terminology they were not aware of. So we kind of want to change that. We want to change that tonight as we talk. Next slide, please. So when we talk about the complexity of healthcare, we have the patient that's in the middle, okay? So the reason why it's so complex, and we totally understand, you have the insurance, and the insurance like copays, deductibles, if you're in Medicare, Medicaid, A, B, C, D, I mean, it is confusing. And then we have the condition that the person is dealing with. Do they have diabetes, hypertension? All those conditions, people know enough that if you have some of these conditions, it's scary. You may have had a relative who didn't do well with these conditions. So there's some fear that's associated with just being sick or having a chronic illness. There's health literacy, meaning, do you even understand what the doctor and nurses are talking about? And does your doctor even take the time to help you understand? We have to think about medications. There's, name brand, there's generic, there's so many medications. There's vitamins, there's supplements. There's a lot of things on the internet to talk about medications and the side effects. You have the doctors and nurses that you have to actually communicate and deal with. In the hospital itself, the hospital is big, it's complex. You have, imaging, you have labs, you have transport, food. It is just a very, very complex system. But a lot of times when we're the patient, we bring a lot of our prior experiences with us, or what happened to Uncle Johnny, because, when he had that procedure, he didn't do well. So that's why I don't go to the doctor. There's the trust issue. Sometimes we've experienced people being passively dismissive, meaning that, they don't really dismiss you up front, but they're not really paying attention to you. There's lack of resources, both by the patient and the hospital. The hospital sometimes doesn't have the resources to help people get rides or help people to get food, because if you don't have your basic needs taken care of, your health may not be that important if you can't eat. And just fear of the unknown. So we know healthcare in itself is just extremely complex. Next slide, please. But we want to talk about how we can be our own health self-advocate. And that is the ability to represent yourself when managing your care in a healthcare system. How do you speak up and represent yourself, your values, what's important to you? Okay, how do you do that? Next slide, please. So remember when you go to the car, everyone's had some problems with their car before, and you do a couple things when you go to the mechanic. You tell the mechanic that you tell them what's been going on with your car. Your car's been making a certain kind of noise. You tell them how long it's been going on. You tell them what's making the sound get worse. And we kind of know about car parts, a little bit, engines, carburetors, tires, but not really. If I did a test tonight, we probably all fail unless you have some experience in taking care of cars. So when the mechanic actually calls you, because now they call you before they start putting things in, and they tell you what's going on, you do pause and ask them a lot of questions, because you really don't trust that mechanic, because everyone thinks the mechanic is really trying to rip them off. So you ask a lot of questions. And before you make a decision on what you're going to fix, you actually you're informed. Most people are. If you're going to spend money, you typically want to know what you're spending money on. If you do not trust that mechanic after you get your car fixed, you most likely are not going to go back there again. So next slide, please. When we talk about your health, we need to display the same behaviors when we're navigating our health. So like as we go to the car shop, we're very aggressive. We want to know what's going on, but we need to display some of those same behaviors when we're talking to our doctors. So when you go to your doctor, you want to tell them what's going on. That nothing's wrong. I'm great. Well, maybe you are great because maybe you have very good health care, but you go to the doctor to tell them your symptoms. And you want to explain it in a very succinct way. You want to tell them what makes the pain get worse, what makes it get better, and how long you've been experiencing the symptom. You ask questions. They may ask you questions back. You ask them questions back. If you don't understand what the doctor or the provider is telling you, you ask them, we are here to serve you. So you ask them, please explain. I do not get that. Please explain. It's important that before you go to the doctor, it's okay to go online and review some articles and, come back to your doctor and tell the doctor your concerns. You want to kind of stick to whatever the major problem is. You don't want to go too random on this online stuff. But if you want to know more information about diabetes, high blood pressure, or if you're experiencing a cancer, it is okay to go online, write down your questions, and bring it back to the physician. Once you've talked to your doc, you told them what's going on, they've kind of asked you some questions. Now it's time to pause and listen and see what your diagnosis is and what the treatment is available. All right. And, sometimes people don't give physicians a chance to even tell, what the treatments are. I'm not doing it. I don't believe in it. Okay. So you always want the information before you make a decision. Even if you don't think it's not aligned with your values, that's something you just don't do. You need information to make an informed decision. That is what we have to always pause and get information. If you don't trust your provider, you think they're not listening to you, please get another provider. No one is stuck to the hip to any doctor or nurse practitioner. That is not, you got to get someone else that you trust or you can learn to trust, because your doctor is there to try to relieve suffering, So, you got to trust the person you're working with. Next slide, please. So I have some patients I want to go over because these are kind of people I see in clinic. And it's very interesting how it ends up, how I perceive the patient sometimes. So I'm going to share with you some patients. You should know you're the doctor. So Mr. Small, he's a 58-year-old guy. He's coming to me to establish care. He has heart disease, and he actually had a heart attack in the past. We're going to call that a myocardial infarction. We're going to be sophisticated, okay? He has high cholesterol, hypertension, and he quit smoking 2 years ago, and he's from Virginia. So he's a transplant. Like, I don't know this guy. So when I start talking to him, I asked him about his medical history. He stated, it should be all be in my records. Okay, great. Then I asked him about his meds, like what is he taking and all that. It should all be in my records. And then I asked them, after his heart attack, did he experience any like negative consequences? Like, is his heart weak? Did he experience any bad rhythms? He said to me, "You're the doctor. You should know. You all never look at the records." All right, let's talk a little bit about Mr. Small. You think Mr. Small is being his own advocate with these type of comments? Yeah, not really. Let's move to the next slide. So being your own patient advocate is doable, and we need to consider some things. So next slide, please. So when you're your own advocate, you have to think about your health, your conditions, and you should write out a list of concerns of what really is keeping you up at night. What are you concerned about? Are you concerned about dying from diabetes? Are you concerned about, and be really honest, are you concerned that you're going to get a stroke? What are your concerns? And you have to learn to be a good historian. You're telling a story. People who tell better stories get listened to. So you want to learn how to be a pretty good historian. You have to have a communication plan, meaning, how are you going to contact this doctor once you leave the clinic? Are you going to call? Are you going to go on some crazy switchboard and be transferred 30 times and then get to a totally different clinic? So you have to talk to the doctor about the communication plan when you are there. As we mentioned, if you don't like what someone's saying, or it just doesn't sit well with you, please consider getting a second opinion. And I encourage my patients that don't really trust me or feel some kind of way about what I'm telling them to get a second opinion. I actually help set it up because I feel very confident in what I tell to my patients, and I want them to be confident if they get a treatment or a procedure. I want them to be confident too, because that's how you do. It's a relationship. We're like in a relationship with each other. So we have to trust each other. So yeah, I'm not offended if someone wants a second opinion, and I will help set it up. All right. Also remember, if your memory's not that good, or if you get real nervous, or you get, a little bit just uptight when you go to the doctor, bring along a friend, bring along a family member who can help you navigate this healthcare system. All right, next slide, please. So when you go to the doctor, please use your time wisely. So you want to do your pre-work. Jot down any questions that you may have. Very important. More importantly, be on time. And people say, oh, the doctor's never on time. But coming to the doctor late, you got to remember, they're on a certain schedule. And if people are late, you don't eat lunch, then the doctor's irritated. So you really want to be on time. And I hate to say it, and the doctor should try to respect your time and be on time too. Let the provider know your preferred name. So if you're an elderly woman and you don't like them calling you Jenny, just tell them, hey, I go by Miss Smith. Tell them. Even if they don't ask, tell them, because sometimes I see these young people don't know, and like in our community, I don't feel right calling someone Jenny or Pat, and they're my elder or even my age. I just think I should call people by their their surname, and then if they want me to call them their first name, I will. But I kind of start with Mr., Ms. until they give me permission otherwise. But so if people are not calling you what you want to be called, let them know. This is a really big one, try to stick to the specialty you are seeing unless it's an emergency. So if you're seeing a heart doctor and you had a glaucoma surgery 2 months ago and your eye is burning, not saying you're blind, but you're having some burning or redness, don't spend the clinic visit talking about your burning eye. That's cardiologist or whatever specialist you're seeing has an area of expertise. The only thing, basically they're just going to send you to the ER. They don't have enough expertise on what the burning eye means. And I'm going to tell you some hints of how you can get the cardiologist maybe to help you with the burning eye a little bit later in the presentation, but stick with who you're seeing. If it's an emergency, you need to say, you're having bright red blood per rectum, you're having bleeding, or, you passed out on the way there. Well, that's to me cardiology, but yeah, you would say something like that. But old history or things that have nothing to do with the specialty, try to keep them out of your subspecialty visit. Be very intentional and specific. Stay with the organ. If it's liver, doctor, liver. If it's lung, lung. Heart, heart. Try to stay with the organ. Bring your current medications, all right? They're in the chart. Okay, a lot of times the chart are not accurate. And then if the chart's, not accurate and you don't bring your medicines, then I can't change your medicines. So it's just like a waste of a visit. So bring your medicines so we can do a reconciliation of your meds. I would bring them every time, honestly. Very, very, very important. And depends on the doctor, you should take your meds before, unless you're given specific instructions not to. Because let's say you have high blood pressure and you don't take your meds. You've wasted an office visit. I could have used that office visit to increase your medications because I would have what your blood pressure is on medications. But if you don't take your meds, wasted office visit. You are trying to get that doctor or that provider to use the time effectively, efficiently, and you want that doctor to work on the top of their license. If you're there for some specialty or your diabetes, you want them to focus on what they are good at. And for that to happen, you got to know how to navigate the healthcare system. You got to know when to talk to who about what, etc. If you don't understand what the provider is saying, please, please, please ask the provider to explain. And I cannot emphasize this enough. If the provider cannot explain and, being dismissive, you got to find somebody else because that relationship is already bad. Remember, with your doctor, even with your doctor, call them by their preferred name. Now, I would stay away from sweetie, honey, baby. And I know those are terms of endearment, but what happens with sweetie, honey, baby, it tends to be not all doctors get that. So call them. If they don't mind, that's fine. You guys can talk that. But when you first meet a person, stick with their names they want to be called. All right, next slide, please. All right, okay. So what does self-advocacy mean? And we've really already talked about it. Ask questions, ask questions, ask questions. When you give information about yourself, be honest. And I love my patients who are honest, even if they got issues, yeah, they may drink, but they're like, Dr. Williams, I'm trying, I messed up. I'm going to go. And I'm like, okay, thanks. Okay. Thanks for telling me. We're going to get you back in to see X, Y, and Z. But it's like that honesty means so much to me because when it's time maybe for them to get if they're honest with me, I can work with them. So I don't want to kill somebody because they didn't tell me something. I'm giving them the wrong meds and it interacts with the alcohol, so I just love honest patients. Remember, we have to communicate, but we have to communicate, that's why relationships are important, how you would want to be communicated to. I see people in the hospital and, they went off because they didn't do something for mom. But man, you can't go off on people that are there, 10 hours a day and they may have nothing to do with it. And now the nurse doesn't even want to go in the room and you're going to go home. And now no one wants to go in the room because people go off on them. So just the way we communicate is extremely important. And I think, just communications, that's just the way we do it is extreme. You should be respected and you should respect whoever you're dealing with. Build your health knowledge. People treat people differently when they know a little bit more. You can't pull the, rug or what do they say? I don't know what the phrase is, but anyway, you just, if you know more, you become actually a stronger advocate for yourself. And collaborate. It's about collaboration. It's a relationship. It's about getting better. I'm trying to help you. You're trying to help yourself. We help each other because honestly, if you're going to the right doctor, when you get better, it makes the doctor feels better. It makes it, he just is like gives the doctor crazy joy. So, you know, it's a true collaboration. All right, next slide. If you happen to be serving as someone else's health advocate, maybe there's a person in your family who's had a stroke and, maybe their memory's not that good or they have some kind of condition that they're not able to totally speak for themselves. When you take that person to clinic, still allow them to speak, even if it's kind of garbled and not that great, because that person needs to communicate with the physician. They need to feel valued. They need to feel special. They need to feel like they matter, and that they're a part of their healthcare. So let the person tell their story first. Even if it's for 3 minutes, let them share their problem. So the goal is you want the person that you're speaking or that you're serving as a health advocate to feel connected to the provider too. And most doctors, I'll be honest, they want to hear from the patient who's experiencing the suffering firsthand. So when I see some people who come into my clinic and maybe it's a husband-wife combo, and nothing's wrong with the husband, he's just not as engaged, but he could learn if made, if forced to. And the wife just starts talking. I'm like, hold on. I need to listen to Mr. Joe. These are made up names, by the way. So that I don't have anyone like that. But yeah, so let that person speak, even if it's for a short period of time, even if it's garbled, let them speak. And then you can continue to be their advocate, but let them know what they have to say is very valued. All right, next slide. Okay, let's talk about Miss Jones. Okay, Miss Jones. This name of this slide is Please Keep Up with Technology in Healthcare. So Miss Jones is a 63-year-old woman, and she has diabetes and hypertension. She is here in clinic to establish care with a new primary care provider. Miss Jones is well informed about diabetes and its consequences. She knows her medical history, her medications, and she really understands what she wants for her health. So this lady is on the ball. This is like the perfect patient. So, I asked her, why is she leaving? Why are you leaving your primary care doctor? I didn't ask her, but whoever this other primary care doctor asked her. And she said her old PCP just wanted to use the computer to talk to her. And Miss Jones says she prefers phone calls and letters. She said, I'm old school. I don't like this internet stuff. I want a personal touch. All right. Let's next slide, please. So there are a couple things you need to know about the electronic health record. So it's a very, very valuable tool to have. All right. So I don't know what system you're in, but the system I'm in, we have something called Epic and we have something called MyChart. So that's how we communicate with our patients. Very important. So it connects you with your health team. You could have a problem at 5 p.m. and you say, hey, Dr. So-and-so, I'm having as long as it's not like an emergency. If it's an emergency, you need to go to the emergency room. But it's something, you can wait till tomorrow. I'm having problems with this. What do you think? And then that person will get an answer the next day. So we answer within 24 hours, and no one monitors phone calls. We don't even know, I don't even know people call for 10 times. I have no clue. But if they MyChart me, there's a digital footprint, and there's something called professionalism. We have to empty our boxes and take care of patients. So the phone call, right now, I would try to stay away from and get electronically on board so you can have better health care. You can refill your prescriptions online. I'm running out. Let me see how many I have left. Okay, refill your scripts. You can also look at the notes that your doctor writes about you. Don't you want to know what the perception the doctor or the nurse practitioner has about you? What's also good, let's say you have an office visit and you look at your record, you can look at the note and you can see what my plans were, what the doctor's plans are for the next visit. So let's say the doctor said, you know, I don't know, get a blood pressure cuff, walk 3 times a week. You know, maybe you forgot, but you could always reference that note to make sure you do what we wanted you to do. Maybe the doctor ordered you a test and you haven't heard anything back. You can reach back out and say, hey, no one called me to schedule that test. So it's a way to stay actively informed. Remember, every time you go to the doctor, you want that doctor to, work at the top of their license. You don't want to keep going over things that you were supposed to do the last visit. That should be done next. You want to always use that visit to, get the best for your health. So you can read your records. What also is very important is that what if on your records it says no show, no show, no show, no show, like you're not coming to your appointments, but then you've been in the hospital every time, or maybe someone in your family's sick and you went away to take care of them. Now you look like a non-compliant patient. No shows, like you could care less. You need to get that corrected. You need to get that taken off your chart. So always stay in your records so you know if the things we're saying about you are actually accurate. And also you can use it as a tool to be prepared for your next office visit. You can see your lab work and your images. Maybe you had some blood work. Now, the images, I don't know about that. I'm a little skeptical. I don't like how they release images to people on Friday and then no one's there to explain what they mean. So for me, I like the blood work, but some of the images, I think it should wait for doctors to talk to the patient. But, it's still available. It's still being your own health advocate. Sometimes there's not enough information to understand the imaging. Of course, you can update your family history. This is interesting. So I had a person who came to me and said, you said I was, okay. They said you said I was a SOB. Okay. That's our acronym for shortness of breath. So if you are going to read the chart, patients have gotten mad about things. And I'm like, no. That's what I said when you were in the visit last time. So that's why you got to like your doctor. You guys have to be open with each other. You can just call them back and say, hey, look, why did you put that on my chart? And then you can explain, no, it was last time I saw you, but I haven't seen you yet this time. All right. So electronic medical records, the point is very important. You will be left behind if you do not get on it. But can you imagine what would happen if you don't get on the electronic medical record? Don't you think the equity gap would actually be widened if we don't use? There's going to be a population that uses it. There's going to be a population that doesn't. That won't be good. All right, let's move to the next slide. Let's talk about technology. Now, you guys know that right now people can use their Apple Watches to detect a lot of heart abnormalities, in particular, something called atrial fibrillation. And this is a rhythm in which you're at high risk or increased risk of having a stroke. And we have medications for it. So, patients don't get a stroke. But, people are using watches to diagnose their heart rhythms. So we have to be up to speed. We have to be informed of what the country is doing. We cannot be 5 years behind on things like this. So be informed. Hey, you can tell your doctor, hey, I have an Apple Watch. So what should I do? How should I use it? And he or she can tell you how they want you to use your Apple Watch to be more informed. All right, next slide. So digital health is here to stay. And if you don't adopt it, there will be consequences. So we already know there's populations that are underserved and they're already disadvantaged, but this will definitely widen the inequity gap. All right. In the next couple of years, we're going to be using the electronic medical record, what the doctor's typing on when you go to the office. We're going to actually use that to notify patients that their surveillance colonoscopy is due. So if you're not getting on the computer, you won't even know your colonoscopy is due. You may not even know they changed the age of colonoscopy. The first colonoscopy should be done at 45 instead of 50. And the reason for that is there's populations, and particularly Black people, have a higher incidence, or they have more colon cancers than white. And the death rate for Blacks is just is 40% higher than white people. So if we don't use these digital tools, we'll suffer later on. But it's kind of it's not fair because everyone's not going to have access to the digital tools, but we'll have to figure out, how do we get these phones to people who don't have the resources to get them, because their health will suffer if we cannot get them the appropriate devices. And next slide, please. This is there's a patient that I met earlier this week. His name was Dave DeBronkart, and he told his story that I thought was just an excellent story. So in July of 2009, he went to the doctor. He was having some pain in his shoulder. But listen, it was no big deal. It wasn't like he could still lift his arm. It wasn't, like he wasn't incapacitated. He just had pain. So he went to the doctor. The doctor does a simple chest x-ray to look at his shoulder joints. But when they did the chest x-ray, they saw a nodule in his chest x-ray. And then they did more tests. They did, CAT scans of his chest. They did CAT scans of his abdomen, of his brain. Basically, what they found is that he had stage 4 kidney cancer. And stage 4 means that the cancer is out of the capsule of the kidney. It's metastatic. It has spread to the rest of the body. And he had it in the lung. He had it in the brain. He had it some in the bone. So the cancer was all over his body. So they gave him 24 weeks to live. All right. So his doctor told him, hey, look, we don't have any therapies here for you. But I'm going to give you, a name of this patient advocacy group. It's a community of people who have, kidney cancer. I just want you to hook up with and, for support and maybe hospice care and all that. And the guy said, okay. So next slide, please. So I saw this gentleman just on Monday in Orlando, and he was speaking and sharing his story at this national conference. And he said once he connected to the community, this patient advocacy group, they helped save his life. And they call him ePatient Dave because ePatient stands for equipped, enabled, empowered, and engaged. Boy, that sounds like something we know. And so he was speaking on being an advocate for digital technology and how that can advance care. And he says, and he said it so profoundly. He said, how can you participate in your care when you can't even see what the doctor's seeing? And then he said that, the patient shouldn't be left in the dark. I guess he made a quote. I guess I can say exactly what he said. I can't see my slides right now. But he said, if you keep us, meaning the patient, in the dark, then you, the doctors, cannot complain that we are ignorant. So he blamed the doctors that, you don't give us any information, but you say we're not that smart. So what I'm trying to just say today, use that medical record like, I'm not saying you have to be obsessed, but understand your history and really use it. So this guy's alive today. He was diagnosed with metastatic cancer. And what the patient advocacy group, next slide, please, what it actually did, it connected him to a program that had a medication in clinical trial for stage 4 renal cancer, and it was in trial. But that our doctors don't know what's happening around the whole country for everything. We just don't have that kind of bandwidth. So these patient advocate groups, if for specific diseases, they can share who's the best doctors for these diseases, who were the best centers. Kind of, since they're going through the same journey, they can share what kind of medications, how the medications make you feel, what's in clinical trial, and they can share with you things that your doctors just can't tell you because those people are experiencing it firsthand. Also in these patient advocacy groups, there's physicians who join, but these physicians are specialists in this specific arena, whether it's a kidney cancer group or a, you know, like a lung problem group. There's the doctors who are joined are focused in that area. And then also who joins these groups are specific researchers that are interested in researching in that group. So now you have everyone. You have the doctors who are good at it, you have the people who are researching the area, and you have the people who've experienced the problem. And these groups are usually funded by like the NIH or the government or the sector. Groups are extremely important. Next slide, though. So there's a group, it's called Rare Disease Group, and this group does rare diseases in the heart and around in the body. And there's in this specific group, there's 3,300 members. But if you look at the participants by race, look at this. Only 1.4% of the group is Black people, and 90% of the group is white people. So these are where inequities, I mean, they're all over. But so these people that are in these groups will have access to things that others will not have access. So access to care is not just having the ability to drive to Providence Hospital. Access to care is having the ability to have top-notch, sub-specialized, just innovative type of care. Certain groups don't have access to that type of healthcare. There's some healthcare that's happening right now that would really blow your mind. But if we don't have access, we don't even know it's there. We're still worried about our A1C while people are getting their stage 4 cancer treated. So these groups, extremely powerful, extremely important. If you have a rare disease, a very advanced cancer, really important to get into a patient advocacy group. Next slide, please. So how do I find a reputable patient advocacy group? Ask your physician. Depending on the condition, you can ask the specific organization. So we have colleges, like there's a college, American College of Cardiology, American College of Hepatology. We have colleges at the United States, like they're what kind of governs what we do. So you can ask whatever the college is. Go online and do your own vetting. That's appropriate. Try to stay with organizations. Try to stay away from so-and-so chat room. But go to, Medscape, things that go to PubMed, things that you can read articles that are pertinent to your problem. But stay away from people's opinions and everything. Go to the source and the research source. And you can just ask your doc, hey, is there a local patient advocacy group in the hospital that I can just start there? And maybe that would be an opportunity for you. Next slide, please. So kind of summarizing what we've talked about, being your own advocate is going to be key to navigating the healthcare system. You need to have information about your health condition, and you need to be able to provide information and ask questions about your situation. We have to get used to using the electronic medical record to look at our records real time. I'm telling you, we cannot stop all inequity because a lot of it is systemic, but this is an area that divide is going to get bigger if we do not embrace electronic medical records. I think we can embrace it because we can embrace Facebook and everything else. We can do this. Understand that the hospital is going to use the digital platform to communicate with you. So, I prefer someone to call me. Okay, that's fine. That may happen the next year or two, but eventually that's going to pretty much stop. We don't have the bandwidth to call everyone. Why it's also important, I forgot to tell you this. I think this is going to be really important. We're going to have ways to identify people who are at high risk for certain cancers, for certain diseases, just by looking at your medical record with AI, artificial intelligence. We're going to be able to take things out of your history and say, oh my gosh, this person is at high risk for amyloid. This place is at high risk for cancer. And then you're going to get a message through your MyChart or through your electronic platform and say, hey, we think you should do a genetic test for X, Y, and Z. If you're not connected, you won't ever get that information. If you are connected, you have to understand some of these tests that are going to be offered to you in the future are going to be very powerful and impactful to your family. There's certain diseases that run in Black people. There's in different cultures, regardless, Black, white, that now we have genetic testing. If we can find that someone in the family has that disease with the genetic test, I don't believe in genetic tests. Well, maybe not for you, but for your children and your children's children, we want to get to the point that we can do what we call precision medicine. I don't want to be able to treat you and I treat you like everybody else. I want to know what works for you because I have your genetic profile. What meds work for you better? What should I start you on? Then I can go to your family and say, they're at risk for this disease. What should I look for? So, in the future, you may be in the position that you're offered some of these tests, and it could be very empowering to a family to know they have a condition that's running through the bloodline, that we can treat it earlier and, decrease, the suffering from the disease or whatever. So those are the things you're going to be hearing about in the next couple of years. You're going to be getting, offered testing XYZ because we're moving to something called precision medicine. And like I stated before, these patient advocacy groups, those are game changers that can elevate the type of care you get because it's going to connect you to the right people. So always think about that if you have a rare disease or something a little bit more complex. All right, next slide. So that was my presentation. I hope you guys got something out of it. And I was just kind of going from my experience and what I hear from patients and how I want you to be more engaged, more informed, just be an advocate for your health. So I'm going to open up for questions. I don't see any questions in the chat, but
there's one from Patsy Gordon. Let me take the banner down so we can see our question. And there's her question right there, Celeste.
Yes, thank you. So describe what a second opinion is. So let's say you go to the doctor and you're diagnosed with a condition. Maybe I'm a heart doctor, so I'm going to use a lot of heart things, but that's okay. Maybe they say you have a heart condition like heart failure. You don't believe them. I mean, you're like, no, I feel great. But they say, your tests aren't that good. And, things are not looking like, looks like you have this diagnosis. I feel fine. You're just trying to put me on a lot of medicines. Okay. So that person does not believe they have this condition. So you should go for a second opinion. So a doctor who is in the same specialty and not a partner of that doctor. So if you were to go to me, don't go to any of my partners. Go outside the system. Go to University of Michigan. Go to Spectrum Health. Go to a doctor who does the same thing I do. So if you're going to like a specialist, go to a specialist, but outside of the system because, we're all friends. They're going to look at my note and say, Celeste knows what she's doing. Never go in the same system. Go outside the system, different person, have them either review your records and all your documentation, or you can start over depending on your insurance and see what they say. And you can then decide, was your diagnosis actually correct? And is your medicines actually correct? And is your prognosis actually correct? So that's what a second opinion is. And it's okay. It is fine.
Next question.
Listen, how safe is digital records? Just as safe as Facebook and everything else. Okay. I'm going to tell you guys something. These records are it's like for our banks, our credit cards, they're being hacked. And they are sometimes, I've heard of cases in which they're putting our records for ransom. So they're taking 50,000 records and say, if you don't pay $5 million, we're going to, let them go to the internet or something. So yeah, they're just as safe as anything else. No, it's just like it's everything else. They're heightening their security. We're doing a lot in our healthcare system to make your records safe. I mean, we're doing a lot. I can't even hardly get on the computer outside of the system, but there's always a chance. If they are hacked, the healthcare system lets you know. They typically give you like privacy guard for 3 years. but it's just as a risk as anything else. But not having, you still want to get it just because there's a chance of being hacked. I don't know. That's not enough not to be on it, though. Not enough. Because everything is hackable. Boy, that's probably not what you wanted to hear, Sister Howard, right? Yeah. But I'm just being honest. It's the truth, though. Yeah. Mm-hmm.
Absolutely. It's one of the things you ask your patients to be with you. So I think it's a great thing, Sister Celeste, that you're just as honest with us. And that's why we love having you on this platform, because we know the quality of information that we're getting. So we've got some people that are giving you shout outs. They're saying, thank you.
Okay.
So we've got a few of those out there.
Okay.
And I just want you to know, Dr. Celeste, this message, this information is very, very important. You and I were talking prior to coming on the show, and I was sharing with you my dad and the challenges that I was having teaching him to be his own best advocate. And my father is up in age, y'all. He's an elderly person. And when I say that, I mean no disrespect, but he's my dad. And I think it's with his age group sometimes.
That's right.
They are comfortable with the doctor being in the know. And he feels like he doesn't have the same equipped. He's not knowledge. He doesn't have that expertise. So he just listens. Whatever the doctor says, that's the gospel. And I tell him, no, Daddy, you got to ask questions. You got to do a little research. You got to not be afraid. Not that you're challenging him, but because as a doctor, you trust him. So in turn, you should be able to say, this is my health. These are my concerns, and speak up. And so my father is in a position now where he wish he could turn back time and take some of that knowledge that his loved ones, his daughter, his wife, were trying to get him to do. But guess what? Once that time is spent, it's spent. So that's why it's so important for all of you out there under the sound of our voice to help your loved ones, help your parents and uncles and aunts and those that are in that age bracket to not be afraid to speak up to their doctors. So I am going to check the chat one more time. We got looks like a lengthy one here from Sylvia Ellis.
Okay. Great information. I've been negligent about being electrically connected with my doctor, but since you remind me of the importance of staying to better. Oh, that's wonderful. That's wonderful. And there is something called a digital divide. It's kind of unfair with the well, you're on Facebook though. Wait a second though. If you're on Facebook, you're on Facebook, so you're good. You're gonna be okay. Good. So thank you.
Yeah, some of your friends are giving you shout out.
Thank you. Thank you. And if you guys have any questions, just let us know. Don't be afraid to ask me. That's right. That is right.
Yeah. So, Dr. Celeste, we are not going to belabor the time. This is time that's been well spent. Okay. And guess what, you all? Dr. Celeste will be back with us again on next Thursday at 7 p.m. So we're going to ask that you take the time to log in with us next Thursday, December the 21st at 7 p.m. And we're going to be talking about matters of the heart. Yeah. So this is Dr. Celeste Williams, her area of expertise. And so we know that it's going to be quality information. So we ask that you take the time. Many of you will be off from work. So you'll be able to save the date. Go ahead and sketch that on your calendars right now. And we look forward to you joining us on next Tuesday. I am going to take Dr. Williams off the screen.
Okay.
So I can do the announcements. So we thank you, Dr. Celeste.
Thank you. Thank you for the invitation. I appreciate it. Thank you. You guys have questions for me next week.
Yes.
All right.
So goodbye.
All right. Thank you.
So again, we want to say thank you to all of you that joined us on this platform this evening. We thank you for your questions, and we want you to know that you matter. It's important to us that we give you powerful tools for you to be your best advocate. So please, 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 If you have any questions from this session, you can send them to me, or you can send them to Dr. Celeste, or you can just write them down and we can discuss them next Thursday at 7 p.m. So without further ado, the announcements for today are: on this coming Saturday, we will have COVID-19 testing at Greater Grace Temple, 23500 West 7 Mile. And for the first 25 people, we will be giving you a gift certificate, as well as a little gift bag to say thank you for all of the participation you've given us. And you know, this is a grant, so data is really, really important. So we don't just want to stop with the 25, we just want to reward the first 25. So if you could please plan to stop by and just get your nose swabbed. We do want you to know there is a rise in respiratory infections right now due to people being indoors, and the proper ventilation is not as best as it would be outside. These respiratory infections are on the rise. So we want to equip you prior to going to your family gathering that you can go in the know, knowing that you are not a carrier, you are not carrying COVID-19. So please stop by and see us this coming Saturday at 10 a.m. And then on this coming Friday, our beloved First Lady Chrisette Ellis will be going to the Citadel of Praise with First Lady Tracy Ellis for her Women's Weekend. First Lady is scheduled to be with Lady Ellis on Friday at 7 p.m. So PWP, we want you to show up for First Lady and let her know that she matters, and the content of information she will be sharing is going to bless us as well as those ladies at Citadel of Praise. Well, God bless you. And until the next time, I thank you. We thank Bishop Ellis for affording us the opportunity to utilize this platform to bring pertinent information to you. God bless you, and we'll see you soon. Take care.